When it comes to diabetes, the numbers are staggering. Over half of Hispanic adults in the U.S. are predicted to develop type 2 diabetes during their lives. According to the Centers for Disease Control, that's more than 30 million people. Dr. Janine Suarez with the Latinx Diabetes Clinic, Joslin Diabetes Center, joins us now to discuss the outreach and supports available to these patients. So let's begin with symptoms of diabetes and when someone should seek care.
So people with diabetes, if you have had undiagnosed or uncontrolled diabetes, there are a few symptoms that could be leading to that, but the three most common symptoms I would say would be feeling very thirsty, having to urinate frequently. The second symptom would be unexplained weight loss, and the third symptom would be blurry vision.
Now the Latinx community is not a monolith, so why does type 2 diabetes hit that community harder than others?
So through research, it's been shown that people of Latino origin are at higher rates to develop diabetes. They also have higher rates of having uncontrolled diabetes, and they're higher rates to develop complications from diabetes. So this puts them in a unique category when it comes to diabetes care.
Why is there a need for a center that specifically targets an ethnic group, people might ask, and how does it differ from a more general diabetes clinic?
So that's a great question. It has to do with, the sheer numbers. It's been already shown that Hispanics make up about 19% of the current U.S. population, and 11% of Hispanic adults have diabetes, and it's estimated that over 50% of Hispanic adults will develop type 2 diabetes at some point in their lifetime. So these are significant numbers. And about 2 decades ago, the Joslin Diabetes Center created a Latinx program that provides high quality care that is linguistically and culturally attuned to the needs of people of Hispanic origin that have diabetes.
Dr. Suarez, talk more, if you would, about some of the barriers to care.
So we see, a lot of barriers. As I mentioned, people of Latino origin have higher rates of uncontrolled diabetes and develop more diabetes complications. So that is a barrier in taking care of these patients. The second barriers have to do with social determinants of health. It's something that is a reality in this community. We see patients every day that face issues with food insecurity, difficulty affording certain medications, and overall navigating the very complex healthcare system.
What about just something specific like diet?
So we have an entire team at Joslin that is made up of diabetes specialists, kidney specialists, dietitians, and diabetes educators, and we provide care in Spanish, and we come up with a personalized care plan that takes into account the cultural preferences of each patient. We're able to sit down with them, speak in Spanish, and come up with a dietary plan, a medication regimen, and that can be life-changing for a patient that is of Latino origin.
So President Joe Biden is credited with bringing down the cost for insulin. Have you seen the impact on patients and their families yet?
Definitely, that has been a very helpful thing, bringing down the cost of insulin. People with type 1 diabetes, they need insulin on a daily basis in order to live. And many patients with type 2 diabetes also need insulin, so it has had a great impact in our community.
What type of community outreach are you doing to pull out and ensure prevention and treatment, and also to get folks in the Latino community to come to the clinic?
So we are constantly looking for ways to connect with the Latino community in the greater Boston area. We participate in health fairs, we come to interviews such as this one, and we really try to promote diabetes education, health screening, and health awareness through our community-based partnerships.
You referenced this earlier. I'm imagining that a really important factor is that you're providing culturally informed care. That makes all the difference, doesn't it?
Yes, Karen, we really try to take into account the cultural preferences of each of our patients. We have a very diverse population, and to come up with a personalized healthcare plan for them.
So we've been hearing a lot about Ozempic and other diabetes drugs used for weight loss. How is the increased demand impacting the people who need the drugs for diabetes treatment?
So, it is a great medication to help those with type 2 diabetes and people that are overweight or obese, to help them lose weight and bring their sugar under control. There is a huge demand, and we've definitely seen it affect the care of many of our patients. But we really try to get this medication available to them. And like I mentioned, in our community, sometimes affordability of medications can be a struggle.
I would imagine there's an equity issue involved in who can afford the Ozempic.
So, fortunately, many of the people in Massachusetts have health insurance, and we're able to help our patients out with this, but it can be a struggle.
Dr. Suarez, why do you do this work?
So personally, I consider myself to be Latina. I speak Spanish, even though I was born and raised in the United States. Both my parents came here as adults from Puerto Rico, and so I feel that I have the knowledge and the tools to really empower the Latino community to live long, healthy lives with diabetes. And fortunately, I work at a great program that gives me the tools and the support to help this community.
You have any family members impacted in this way?
Yes, so I have many family members that have medical conditions and that have struggled with navigating the healthcare system. So I've really seen firsthand some of the struggles and the barriers that they face living here.
Thank you so much.
Thank you, Karen.
So much. Dr. Janine Suarez is with the Joslin Diabetes Center, and we again want to thank you for your work. Thanks for joining us today.